All right, let's talk about something that affects millions of people but is often, really misunderstood. We're talking about hemophobia. It's that intense, overwhelming fear of blood, and today we're going to unpack what's actually happening in the mind and body.
But have you ever stopped to wonder why? Why can the sight of a single drop of blood, or sometimes even just the thought of it, trigger such a huge wave of panic in some people? And let's be clear, this has nothing to do with being weak. It's a very specific phobia, and it has some surprisingly deep roots.
So, officially, hemophobia is defined by two key words: intense and irrational. It's intense because the reaction is just completely out of proportion to any real danger. And it's irrational not because the fear isn't real, oh, it's absolutely real, but because it can be triggered in perfectly safe situations, like, say, watching a movie or just having a routine checkup.
So, that begs the question, where does a fear like this actually start? Well, it's hardly ever just one thing. Let's dig into some of the most common causes to see how this phobia really takes hold.
The origins can really be all over the map. For some people, it all goes back to one single traumatic event, a serious accident, or maybe a really difficult surgery. For others, it's a learned response. Just imagine being a kid and seeing a parent completely panic at the sight of blood. Your brain can lock in that connection for life. It can also be tangled up with other fears, like a fear of doctors or needles, or it might just be one symptom of a bigger anxiety disorder.
Okay, so understanding the cause is one thing, but what does hemophobia actually feel like in the moment? The impact is both psychological and, believe me, profoundly physical.
This goes way, way beyond just feeling a little squeamish. We're talking about a full-body response where the mind just floods with panic. But what's truly unique to blood and needle phobias is the very real risk of fainting. This is caused by what's called a vasovagal response. It's a sudden drop in your heart rate and blood pressure that just makes you pass out. It's a totally automatic reaction that the person has very little control over.
And this right here brings us to the most serious danger of hemophobia. It's not the fainting, it's what the fear makes people do, or more to the point, what it makes them not do. Someone with severe hemophobia might avoid going to the doctor for years, refuse essential blood tests, or even hesitate to help someone in an emergency. This avoidance can turn totally treatable medical issues into life-threatening crises.
But here's the most important message. This fear is treatable. There are very clear, well-established pathways to managing and overcoming hemophobia. It's not something anyone has to just live with forever.
The approach to treatment is usually layered. It often starts with therapy to get to the root of the fear, which is then supported by practical coping techniques for managing symptoms in the moment. And in some of the more severe cases, medication can also be a really big help. But for now, let's focus on the cornerstone: therapy.
Two of the most effective methods out there are cognitive behavioral therapy, or CBT, and exposure therapy. CBT helps you identify and challenge those catastrophic thoughts that your brain immediately jumps to, which lets you reframe your thinking. Exposure therapy is pretty much what it sounds like. In a safe, controlled setting, a therapist gradually exposes you to what you fear, maybe starting with just a picture, then a video, until that panic response starts to lessen. It's an incredibly effective way to retrain your brain's reaction.
And that's the key takeaway here. This isn't about completely eliminating a feeling, but about gaining control. It's about being able to get a blood test without panicking, or being able to handle a minor cut without spiraling out of control. With the right help and support, it is absolutely possible to manage these reactions and live a much fuller life. Because ultimately, conquering a fear like this isn't just about not being afraid of blood anymore. It's about regaining freedom, the freedom to seek medical care when you need it, the freedom to be present for other people in an emergency, and the freedom that comes from removing a major source of anxiety from your life. It's really about reclaiming a piece of your world.